Okay, so on today's video, we're gonna talk about upper hamstring pain that is in your hamstring up towards the butt. The actual term we use for this is proximal hamstring tendinitis or tendinosis or tendinopathy, a couple different names based on the level of irritation. And so while I'm holding this, is I wanna show you exactly where it is on the body and a little bit of how it looks, because that's really important to this injury. So as you can see, this is the back side of the pelvis with almost all the muscles on here. And these are your hamstring muscles that come up into this bone here called the ischial tuberosity. If we can see that. And as you can see, like the muscle belly is red, and this part, as it goes into the bone, turns white. And the reason that is because there's not a ton of blood supply there. Okay, and that's what makes this really tricky sometimes as to healing, right? Like something that's down in the muscle belly, a strain down there, those can be hard to heal too, but they tend to do a little bit better because there's a good blood supply. But if you start getting a chronic problem up here in this area, up in the upper part of the leg towards the butt, then it has a really hard time healing just because there's not a lot of blood supply. There is a path forward. There's several path forwards for this. We want to show you a little bit today about what you can do and not do to start getting started with this. So the first thing I want to talk to you about is actually not stretching, right? Like hamstrings are probably one of the things that people are like, oh, you got a tight hamstring, you should stretch that. Like everyone wants to stretch hamstrings all the time. This is one time you don't want to stretch it, right? Even to the point where we tell people if they're having a problem, don't even walk uphill, because when you walk uphill, you kind of go like lean forward and you're actually stretching the hamstring. In fact, that's one of the good signs you could, a way of determining like, do I have a problem back here? If you're having pain just with walking uphill a little bit, then you definitely have a problem there in your proximal hamstring. So don't stretch it, don't walk uphill. Even sometimes with some patients, it's being careful with just bending over. Like you wouldn't want to like bend over in this position to like tie your shoes, maybe do it seated, some things like that. Anything to avoid putting a stretch on that, okay? Now, the next thing that we have people do is we want to actually loosen the belly part, the red part of that muscle, because that will help make the whole thing a little bit less flexible. All right, so we're going to do a lacrosse ball. Nadine, who just tossed that to me, we'll show you how to do this. Ta-da! Okay, so so some massage, dry needling, but one thing that you can start doing at home if you get a lacrosse ball or a tennis ball is you can kind of just set it right underneath the leg, right like that. And then you're just going to use the leg motion to sort of gently massage it. And Nadine's leaning back a little bit because that makes it a little less tight. Is that less tight, Nadine?
Yeah.
Yeah.
My hamstrings don't feel particularly painful or tight at the moment, but I know that a lot of patients, like just even being in this kind of seated position, you're going to start to feel your hamstrings pull a little bit. So if you lean back on whatever you're sitting on, just takes a little bit of that pull out so you can do this mobilization without feeling like it's pulling too much on that area where your hamstrings meet your glutes.
Yeah. And then you can kind of do 10 reps with the ball in one position, and then you can move it up a little bit, move it down a little bit, try to find a little bit of a tender spot in there, and just kind of do this little leg kick exercise. If you're really sore, I wouldn't go put it directly on the spot. That's going to be a little bit too much, okay? So that's a good first step of just a way to get a little bit of, it's like, how do we get mobility without stretching? That's the key. This is one good way to do it on your own. Now, the key with this injury where there's not a lot of blood supply is you want to create a little bit of, what's a good word for this? Tension or activity maybe?
Like blood flow,
right.
Contraction to the actual muscle.
Right. Yeah. So we're trying to irritate it just a little bit, but not make it worse, but get the body to start healing. We're trying to get it to heal. So one of the best ways to do this is with isometric type exercises and trying to make them as easy as possible first. So let's demonstrate one of those. Hop on off there. let's have you lie down here. Let's get a little mat. So Nadine, go ahead and lie down and then put your like from the knees up on there. There you go. Okay, so one way that you can do this is we make the lever really short by having most of her leg on the box. And all she's gonna do is just bridge up. It's just a real short bridge. And you should feel like there's a little bit of tension there, but not painful. And then what we do is maybe 20 to 30 second holds for 5 reps. You do this once a day to start. And the idea is you want to just get a little bit of activity there, but not pain, okay? And then the progression from this would be just to make the lever a little bit longer. So, yep, you can go out there and just go, yep, from the calf, and then do the same thing, come up and hold. And I would do each one of these for maybe even just a week, 5 or 6, 7 days of just doing 20 to 30 second holds, 5 reps to get some activity going. So, and then there's a whole lot of progression with this, more than we're gonna go to in this video. Maybe we could do another video, maybe. But we wanted to do this video just to show you where to get started if you do have upper hamstring pain. So don't stretch it, do some mobility with the ball, and then start doing some isometrics, and that's a good start. And then if for some reason it doesn't heal, this is often an area that sometimes people will get some tearing, and so sometimes an MRI is needed, but hopefully that's not the case for you. So, but yeah, we'll have to do another video on some progressions of this if we haven't already. But anyway, hope you get some. This is a good way for you to get started if you have some pain here, and thanks for watching. We'll talk to you next time.